A question that we get from patients is, why do I need alternative health care? Why can't I just go to mainstream and just use my insurance and it all works out? Well, the report card on that is that half of this country is overweight, a third of this country is diabetic. Many people die of cancer. Cancer is one of the #1 killers of us, which is just a problem with your immune system. Heart disease is the #1 killer, and diabetes is third, and fourth is the medical treatment. So the reason that is important, people don't realize that in the mainstream medicine, and they're doing a good job, don't get me wrong, with emergency care and things like that, but the treatments they have are very dangerous. Surgeries, we have a person opened up, you do an open heart surgery, they're very good at it, of course, but there's a danger there. And all the medications, there's a danger in how strong those medications are. If they overdose a person, or another problem that is, there's never any studies on how many of these drugs interact. I mean, people basically, in our profession know that over 2 medications, they don't even know what side effects you can have. There's no way of monitoring that. So there's just a problem with the treatment in that it can be very dangerous. Secondly, or beyond that, is that these treatments don't handle the cause at all. So, for instance, if you have a person that has high blood pressure, they're not finding out the reason for the blood pressure. They just put them on blood pressure medications, 1, 2, 3, 4, how many that they can get by with, basically. And so, yes, it keeps them from having a stroke, keeps the blood pressure under control, but long-term use of blood pressure medication causes congestive heart failure. So when you get older, well, your heart's enlarged and it's real sloppy, and your legs swell up and all this, and then you've got to take a water pill, then you're low on potassium. So just all kind of issues. And we see that all the time with people that started on one, then they had side effects or on another. And again, beyond that, beyond the problems with the drugs, which the body has to deal with, of course, you still haven't fixed the cause at all. So that's why. If you want to actually be healthy, you have to work into an alternative type healthcare system and find out what's going on in the body. And again, we're not against the medical people doing certain things to help with emergency care, but for actual health and long-term health, they're not focusing on the right things to help a person to be actually healthy. They're controlling symptoms, but not actually getting persons to the point that they don't need the medication anymore. You shouldn't have to be on blood pressure medication your whole life. We get people off of medication all the time, not by taking them off, but by getting the problem gone so that their medical doctors can take them off or they can take themselves off. Because we don't do that here. We don't take people off of medication. So I hope that answers the question on that one. It's just important to realize there's a place for both worlds. Now, we realize that insurance covers really only mainstream medicine, but that's the game they play. And mainstream medicine costs so much for any of their treatments, even just a visit to the emergency room is thousands of dollars, that you might have to have that. It's very high tech, it's very high cost. Alternative healthcare usually is very affordable. It's very basically almost cheap comparatively, but we get the job done with underlying causes. So anyway, hope that's enlightening. If you have any questions, give us a call, 228-2040, and thanks.